Medicare 2026, the big changes you need to know now. Most people think Medicare is set it and forget it. Remember that one? At Newsflash, Medicare isn't a rotisserie chicken. And in 2026, it's going to prove that in a big way. Insurance companies, including big publicly traded ones, are already quietly telling Wall Street and large national Medicare insurance agencies they're pulling back on benefits and they're pulling out of counties. They're slashing agent and agency commissions. In many cases, they're signaling they simply don't want to sell Medicare Advantage policies in 2026. I think there could be more than 2 million people on Medicare Advantage who could lose their plans this year. Yep, they'd just disappear. 2 million people on Medicare Advantage who could lose their plans this year. Yep, they'd just disappear. And it's not just city folk. I'm talking especially about rural America. We may see entire Medicare Advantage coverage deserts, big swaths of the country with no Medicare Advantage plan options at all in 2026. Oops, there goes your plan. And if that happens and you do nothing about it, you'll automatically revert to original Medicare Parts A and B. And if that happens and you don't at least pick a standalone Part D plan during the annual election period, fall of 2025, you'll have no prescription drug coverage starting January 1st. Bottom line, if your Medicare Advantage plan disappears this fall, you must do something. And that's just the start. Out-of-pocket caps are climbing. Copays are being maxed out. And those free extras like dental, vision, dollar allowances, gym memberships, they're quietly shrinking or going away entirely. So here's my promise. If you stick with me for the next 10 minutes, you'll understand the biggest changes coming to Medicare in 2026, and more importantly, how to protect yourself before it's too late. If we haven't met, I'm Matt Feret. I spent 20 years inside the Medicare system, leading teams at some of the biggest insurers in the country. And what I saw over and over again were smart, capable people making bad Medicare decisions. Not because they weren't paying attention, but because no one explained things clearly. That's one of the reasons I left the corporate side. Now I help people like you understand how this really works without the sales pitch, without the jargon, just the insider strategies you actually need. All right, let's get into it. Change number 1, service area reductions. Here's one Medicare shock most people don't even know exists until it happens to them. It's called a service area reduction, or SAR. And here's what it really means. Your Medicare Advantage plan is leaving your county on January 1st. They can't kick you individually off the plan, that's true, but they can just delete the plan for everybody on it, including you. Not changing it, not just tweaking it, gone. In 2025, about 1.2 million people lost their Medicare Advantage plans this way. In 2026, I think that number could easily double. Over 2 million people may get those letters. If you're on a Medicare Advantage PPO plan, watch out. Service area reductions aren't just happening in big cities. It's mostly happening in rural America, where losing a plan can mean no Medicare Advantage options at all. That's what I mean by Medicare Advantage deserts. Now, if this happens to you and you do nothing, again, you'll automatically revert to original Medicare Parts A and B, which, as you all know, has a lot of holes in it. When your Medicare Advantage plan disappears, you automatically go back to that, but CMS doesn't automatically enroll you into a new prescription drug plan, unless you're on Medicaid or already get extra help. But for everybody else, you must enroll in a standalone Part D plan or a new Medicare Advantage plan with drug coverage embedded during the AEP or your special enrollment period. If you don't, you'll start the year with no prescription drug coverage and possibly a late enrollment penalty down the line. That's why understanding your options now is critical. So I'll say it again. If your Medicare Advantage plan disappears this fall, you must take action. But there's a silver lining. If your Medicare Advantage plan exits, you may qualify for a guaranteed issue Medigap policy. No health questions asked. Now, normally, if you try to get a Medicare supplement or Medigap, after your first enrollment window, companies can deny you or charge more based on your health. But if your Medicare Advantage plan leaves your county, that door opens again for a limited time. Here's something most people don't know. Agents earn full commission for selling you a replacement Medicare Advantage plan, but next to nothing for putting you in a guaranteed issue Medicare supplement plan. So don't assume you'll hear about that Medicare supplement option unless you ask. Don't miss that window. So have you ever actually read one of those plan change letters you get mailed? Drop a yes or no to the comments. I'd love to know. If you want to talk to someone who will actually walk you through your options, not just sell you the plan that pays them the most money, talk to Nikki and her team at brickhouseagency.com. They've helped thousands of people through situations like service area reductions, employer coverage changes, and plan switches without the pressure or sales tactics. I'll drop their info in the description. And if you think that's bad, wait until you see what's happening to your out-of-pocket limits in 2026. Change number 2, the 2026 reset. Now, let's talk about what I call the 2026 Great Medicare Advantage and Part D reset. Plans aren't just making tweaks this year, they're making big moves. Inpatient, outpatient, and doctor copays, they're being pushed right into their legal limits. Extras like dental, vision, hearing, transportation, gym memberships, all that, they're shrinking or disappearing altogether. And provider networks? They're tightening. Medicare Advantage plans are adding new prior authorizations. In fact, Medicare themselves just launched a pilot program for prior authorizations on certain services for people on original Medicare Parts A and B, even if they have a Medicare supplement. It's called the Medicare Prior Authorization Demonstration Program. So don't believe the media hype that prior authorizations are somehow going away. They're not, and they won't because they can't. It's one of the only ways insurance companies and the government can control exploding healthcare costs. And none of this will show up in TV commercials or ads. You'll still hear about $0 premiums and extra benefits, but pay attention and you'll see a very different story. Change number 3, MOOP jump. Let's talk about one of the most important and misunderstood numbers in Medicare Advantage, the MOOP. That's the annual maximum out-of-pocket, the most you could pay in a worst-case year for your medical care, not counting premiums and not counting what you'll also pay for prescription drugs. In 2025, Medicare Advantage PPO plans have a maximum out-of-pocket limit of up to $9,350 for in-network medical services. For PPO plans that provide out-of-network coverage, the combined in- and out-of-network MOOP may go as high as $14,000, depending upon the plan. That's per year. And for 2026, it's a pretty good bet those numbers will stay near those maximum limits and insurance companies moving your benefits right up to those limits. Whatever the MOOPs are, that's your worst case scenario if you get really sick or injured, but it's real. And here's the thing, it's not just a scary number on paper. One hospital stay, one surgery, a few rounds of follow-up care, and suddenly that $0 premium plan costs you 10 grand. So when you're comparing plans this fall, don't just ask, what's the premium? Or do I get dental? Ask, if something goes wrong, how much could this plan really cost me? If you got hit with a $10,000 bill from your Medicare plan, would you be able to pay it? I want to hear from you. Comment yes or no below. Now, not all Medicare Advantage plans set their MOOPs that high, but a lot of them do. Plans move those around from year to year. So again, read your ANOC this September and take a look. By law, your ANOC, it stands for your annual notice of change, must be in your hands by September 30th every year. That's for people who have standalone Medicare Part D and for people on Medicare Advantage plans. So yeah, that's pretty much everybody on Medicare. Don't throw it away this year. Don't ignore it. It's the key to understanding what's changing before it's too late to do anything about it. I am curious, do you guys actually open those big packets your plan sends? Comment, I read it, or I toss it. I want to see how many of you guys actually read them. So the question isn't if these changes will affect you. They will. It's how and what you're going to do about it. My advice, start early. Right now, think about how your healthcare needs have changed over the last year or so. Read that ANOC carefully and don't be afraid to ask questions. If you found this video as helpful, hit that like button so YouTube shows it to more people like you, and subscribe so you don't miss the next one. I've got a ton of resources to make this easier. Books, ebooks, video courses, my Facebook group, prepareformedicare.com, and more videos right here on this channel. All of it comes from more than 2 decades inside the system. No fluff, no jargon, just what you need to make confident decisions. I'll put links in the description to help you get started. Thanks for watching, and don't wait for October. The earlier you start, the more options you'll have. Here's to your wealth, wisdom, and wellness.